So, welcome to the 1760 sessions, where we talk to founders building systems and impact. I'm Harry from 1760, and today I'm joined by Zed, co-founder and COO of Topaz Diagnostics. It's a Vancouver MedTech building point of care testing across recovery, harm reduction, law enforcement, and cancer screening. Have I got anything wrong there?
Yeah, you nailed it.
Okay. So Zed went from a commission-only job selling urine and analyzers with no training to VP of sales in under 5 years. With my sales background, I find this absolutely incredible. He ran a Stryker division from 38 to $82 million, and then built Topaz to $3 million in its first year. Part of it while going through chemotherapy himself. So Zed, I hope that introduction gives some good background on yourself. Thank you so much for being here.
Yeah, I appreciate you having me. And just small correction, we landed at 1.3 million in our first year at Topaz, but outperformed our projection. So we're stoked about that.
Amazing. Apologies. I must
Yeah,
have I must have taken down that point 0.3 and confused it with 3
you
million.
just projected our this year. That's all. You're just predicting the
I'm
future.
I'm giving you some big targets here.
Yeah, love it. Nothing I'm not used to.
Yeah, of course. So you came out of college, went straight into a commission-only job, and I mentioned it was selling urine analyzers. So there
Yeah.
was no training there, student debt like we all had, and your dad going through colon cancer at the same
Mhm.
time. So can you take us into that first month, the one where you nearly got fired? What was actually going wrong, and what were you living at that moment in time?
Yeah, absolutely. I had no idea I wanted to be in med tech, med sales, or anything like that. I was just a competitive individual who played a lot of sports, and my mom worked in healthcare. And it's like, hey, this seems like a natural synergy of things. Let's try this. Commission only when you have a bunch of student debt, you can't really afford McDonald's. And your car doesn't have AC during the summer, medical or going door to door to medical clinics, I wasn't necessarily being like, oh, this seems like an absolute winner of an opportunity for myself. But I think I look back to delayed gratification quite often in my life, how it's been important to me, to so many other mentors, and obviously I probably wouldn't be here had I not taken that job and done well. But the first month, Harry, was
Yeah.
brutal. Like I got the crap kicked out of me. At one point, I hate to say it, I literally got held by the ear out of a medical clinic because I had just offended the clinic, and so I learned a lot of things the hard way. And as I work with new individuals or people starting their careers now, I'm like, don't be like that Zed guy because he
Okay.
sucked, especially in the first month.
You had to learn all of that to shape the person you are today. And I'm a firm believer of everything happens for a reason. So those hard years you put in at the start have very much shaped where you are today, 100%.
Yeah, absolutely. Adversity is a gift, even when it doesn't feel like it in the moment. So,
Yeah.
uh,
I think I
yeah.
might have mentioned my first role was selling insurance over the phone on appliances, for example, kettles, washing machines. The kettle would cost around £50 sterling and the
Mhm.
insurance was £90 per year. So none of it made any sense. But 100% I learned a few hard lessons there. And
Oh,
you
incredible.
you described going from selling like Slapshop, like an infomercial, to actually
Yeah.
how to conduct a sales process. What was the switch? And was there a deal or a moment in your career where you really felt it just clicked for you?
Yeah, absolutely. As I alluded to, my first month, probably the most critical month of my career, and I didn't know it at the time. I uh, I was all in. Like initially, I'm like, I'm gonna go make a bunch of money. This is gonna be fantastic, and I'm gonna learn my product better than anyone. I am gonna say all the things I think I should say, and it failed big time. And I just tried it over and over and over again, and it failed over and over and over again. And that's where I describe my selling process more like selling on QVC, slap chops, magic bullets, those knives that cut through shoes, you name it. That's how I sold initially. And it was what I call now just feature farts, which is just blurting out exactly what you think your product does really well without knowing who you're talking to, what kind of questions you should be asking,
Yeah.
what your main goal is at each step in the process itself. And it took me a call from my boss at the time to tell me basically I have a week before I'm fired and I have to sell something in a week, otherwise I'm not fired. And I remember in that moment I was kind of upset. As you mentioned, my dad was going through colon cancer. I was in student debt. I'm like, this sucks.
Yeah.
This wasn't what I thought it was going to be. And knowing me, I like adversity. I've always enjoyed someone telling me I can't do something. And I think anyone who knows me says, "Don't tell Zed he can't do something," because I'll be like, I'm so stubborn that I'm going to do everything I can to prove you wrong.
Yeah. I love that.
Um, and that's what I did. I didn't sit in the corner and cry and feel bad for myself. I just got to work. I started to watch Brian Tracy YouTube videos, listen to old audiobooks. I started to read Swim with the Sharks by Harvey McKay, some really old dog sellers in the world, and understood that we can apply a robust formula to each and every interaction. And so what I really came down to is understanding my true goal in every step in the sales process. And if that meant cold calling, if that meant or my first meeting, if that meant closing, it's just what's my true goal in that moment. And sometimes it's just getting to the right person. Then I would probably look at who am I talking to and what would I say to myself if I was in their shoes. And I started to talk a different language that would be more applicable to them. So not feature farting, but saying something that's
Yeah.
applicable to their world. And then I took extreme accountability for every interaction. Like, I was really hard on myself. I would record myself continuously. I would use a webcam at home and stand in front of a mirror and practice my own sales pitch and really focus on the process as opposed to just the product and knowing everything and anything about the product. And it resulted in incredible success where I went from the worst sales rep in Canada at the time to the best the following month. And by the fourth month, I more than tripled the second best person in Canada.
Wow.
And it was the shift of just understanding what your true goal is in that moment, who you're talking to, and what would you say to yourself, and then taking extreme accountability. And you top that off with a cherry of show up right within positive affirmations or just getting yourself in that game on mode, and results just started to absolutely rip for me.
I absolutely love it. There's so much there that it's taken me so long to learn over my 10 years in sales, and it's all about nailing into the process, all the way from discovery to who you're talking to, speaking their language, all the way down to, when you're talking with legal finance teams and actually speaking their language, and then furthermore guiding out a close, because it's all very well someone saying yes, but then it's all the hoops you have to go through from there. And I love the fact that, we have the infomercial example. We call it in the UK, selling like a used car dealer, where it's like, this is,
Yeah.
here's the features, this is what you got. And I was told off in my early days for
hmm
selling like a used car dealer. So it's amazing that you've been on this transition from intern, well, commission only, then all the way up to VP in about
I
5
mean, I
years.
was an intern, absolutely.
Yeah, yeah, yeah.
I was as
You know,
intern as it gets.
do you feel like the main thing that you were doing that other people weren't were diving into your processes and actually practicing on a day to day, or was there maybe something else involved?
1,000,000%.
Right.
You know, I think obviously hard work beats talent in a lot of different ways. And I think there's different things that goes into talent for sales, but um, I looked at everyone on my team, and while I loved everyone, friendly competition, there's nothing more inspiring to me than seeing my name on that
Yeah, of course.
sales leaderboard and being at the bottom initially. But I made a commitment to myself. I was just gonna outwork everyone on the weekend, and I wouldn't say, yeah, like did I work a lot of hours? Sure, but I would wager that I was the most efficient human being that I think I could be in that moment where I would watch sports games and be prospecting at the same time.
Wow.
I would listen to these audiobooks during my drives. I'm not trying to remember every lyric to every Drake song. I'm trying to listen to Brian Tracy instead. So
Yeah.
there's a lot of things there.
Yeah, amazing. And at
Yeah.
25, you were told go build a team with no playbook, and it ended up at I think 73 people is what you told me last time.
Yeah, I was actually a little bit younger even,
Yeah,
and we grew a massive team, and I started to become a grandfather in terms of leadership, where you're starting to manage people leaders, and it was a phenomenal process. But initially, it was like go find. The instruction was, we have this cool product. We want to break into the United States and go figure out how to do it and find people like you. That
yeah.
was the instruction.
So
And I was like, okay, wait, what do we do? And I mean, what I did was I flew around to 7 different cities. I tried to sell myself. I cold called. I developed a sales playbook that was duplicatable, and then started to find people like myself, which was the wrong thing to do. But
yeah.
yeah.
What did that sort of first bad hire teach you then?
Um, don't find people exactly like yourself. There's different ways, for lack of better words, to skin a cat. There's different
Yeah,
ways
yeah.
to do things, and your way isn't just the highway, or it's not just your way or the highway. Yeah, absolutely.
Okay. And at Stryker, you were brought into, you said to me you was brought in to merge two cultures after an acquisition. The old dogs from the acquired company and the hungry new hires. What actually works when two tribes don't want to be one team?
Yeah, it's a long process. I think, I mean, even in the early days as I was building a team, the thing that was most, um, one of my biggest learning lessons was that it's culture over everything,
Yeah,
like
yeah, of course.
legitimately everything. And how to align people around. You don't have to have the exact same people. And that was an error that I made in my early days, where I fell on my face, is you're not looking for the same kind of person, but they need to have the same values, the same mission, some intangibles that are must haves. And then there's some like nice to haves, or there's some where difference of opinion is fantastic to have on a team.
Yeah.
And at Stryker, of course, balancing people from different walks of life is not easy by any means. But I think the secret sauce there is really surrounding building trust around values, mission, operating in a way where people can find commonalities, where we can celebrate differences, because we all want the same thing generally when push comes to shove.
It's really interesting you say that because I think of my highest performing sales team that I've been in my background, and it was when we were a team of about six, and not every person was the same, but we were all pushing each other for the same goal. Because if we didn't perform, the business wouldn't grow, and we all got along in that sense. And then I think more hires came in that were more similar to the team, and the team had this sort of stagnant moment where it was like, okay, they're just hiring more like for like people, which didn't work at all. And what you're saying now is very much reflecting that. So
Totally.
you left Stryker and then started ZedMed to help startups avoid learning commercialization the hard way, essentially. Um,
Yeah.
what's the mistake then that every medtech startup makes on go to market, do you think?
Yeah. Yeah. I started my own consulting organization because I thought, what would younger Zed, when he first expanded this product into the US, want or could take advice from older Zed, who'd been through Fortune 500 and learned some best practices of top med tech teams and companies. And that was the basic premise. And what I firmly believe is where I've seen a lot of companies that I've worked with as well, where they make some errors, is lack of clarity around expectations. I think that's a big error, and then just running a process of understanding your main company objectives and boiling that down to certain KPIs, like just running a funnel process of goals from financial, intangibles, market share, what does that mean for that next layer of the organization? What does that mean for the next layer of organization to create really concrete expectations, KPIs, great comp plans, how to develop realistic and tangible quotas. They all work in synchrony, but the thing that I've seen the most is disjointed goals between one section of the team and another section of the team that don't both funnel to overall business objectives. And that's what I've seen creates a lot of things like turnover, um, disjointed cultures, um, working in environments where people don't know necessarily what they're doing or what they're trying to achieve when you ask them simply. And you need to be locking arms big time when you're going to market as a startup. So yeah.
Love that. And then whilst you were working for ZMed, you had a consulting client, Dr. Matthias Volk, the man people call the godfather, I think you said, of in vitro ethics.
That's
Uh,
right.
so he read your, I take it, read your go-to-market plan and effectively said, come and run the offense yourself for Topaz Diagnostics,
Yeah.
his equity. What do you think he saw in your initial plan that made him say, right, this is the guy?
Yeah, absolutely. Luckily enough, Dr. Volk and myself, we had a, basis of trust. We'd worked together at a couple companies ago in some respects, and we've always, innately trusted ourselves. And when we started to work together on a consultant client relationship, we had a lot of like shared values surrounding loyalty, honesty, trust that we honestly just bonded over when we got together. And as I started to uncover the opportunity and some of the intellectual property that he carried and the potential of what that could mean, and how it could impact patient lives. I actually had a personal connection and an affinity towards everything, which was my brother-in-law. He passed away from his addiction, and that was just over 4 years ago now. And at the time when we were looking at Topaz, it had just been about a couple of years, and there's a lot to understand being on the patient side and knowing Tyler's story, and how he dealt with addiction, all that he had to go through in his battle of over 13 years. And the problem that we are inherently solving for our customers had to do with serving and impacting the people that are navigating recovery.
Yeah.
And so through understanding my own go-to-market plan, the market itself, the industry on a deeper level, and the impact we could play on patients' lives with a simple in vitro diagnostic test, became so much more profound to me, and probably showed up in the work that I delivered to Matthias, where he was like, "Huh, this is actually pretty good," and off we went from there.
So it's a real showing of you having passion for the cause. And that probably leads me in perfectly to what I wanted to talk to you about today, and that's false positives.
Mhm.
And can you share for us why false positives are the problem you chose essentially to help?
Yeah, absolutely. You know, previously I had experience with serving in the recovery space or working with in vitro diagnostics for drug testing, and um, I treated it like a commodity. Like, hey, this thing says you're positive or negative for X drug, and didn't really know what it meant. But as we learned more, and previously just thought, oh, employment drug tests and stuff like that. And that's pretty common to everyone. When anyone thinks drug tests, they think like maybe sports drug test or employment drug test,
Yeah.
but they don't necessarily think about drug testing within people in recovery and or people that are dealing with pain management. And the reason why the impact is so much greater there is because it can literally change someone's life. And in Tyler, my brother-in-law's case, a false result on a test while in a recovery program could mean one of two things. It could mean the recovery program says, "Hey, you're in recovery. You're supposed to be here, and you frequently abused this test. We're going to kick you out of the program." Like that's it. That has happened at recovery institutions. The other point to that is if you get a false result on something, and you know that you did not take something as someone being a part of a recovery program, you might say to that place, "You're accusing me of something that I didn't do. F you guys. I'm out of here. And guess what? I'm leaving you all a bad Google review and telling all my friends that to never come here." And so it presented a real business problem
Yeah.
as well. And the false positives, the reality happens is some people might be on parole. They might go to a recovery facility. One of our actual very first customers at Topaz, they told us a story that to me was very profound, where they had someone on parole who went to their facility. Their whole staff firmly believed that this person did not take this drug. Their results showed a positive. They all believed it was a false positive, but they had no choice but to report it back to the parole officer, who then had them incarcerated again. Changed that person's life
Right.
forever based on one simple test. And that is not good enough. That's where we're here to be disruptors. And that's why we chose that problem, is because it
Yeah.
can change people's lives. And for Tyler's case, my brother-in-law, the night that he overdosed, he was not at a recovery program. He was on his way to one. And so we know the time that you're outside of a program is critical moments where you don't want to be left to the streets because things can happen. And in Tyler's case,
Yeah.
you know, it wasn't good.
And it's look, false positives are often treated as acceptable, which we both know they aren't. What does it fixing it actually look like at the product level then?
Yeah. So the reality is within the opioid crisis itself, there's new drugs that are being cut with different substances all the time. Like we've all heard now of fentanyl.
Yeah.
Oh my God, cocaine is being cut with fentanyl, and that's what's calling all these overdoses. You know what? It's actually something called carfentanil, which is 100 times more potent than normal fentanyl that can cause a lot of overdoses. Then
Wow.
there's other substances like called xylazine, medetomidine, nitazine, and these substances can also cause overdoses. So the problem is the illicit drug supply can't keep up to or the illicit drug supply, drug testing generally can't keep up to what's being put in illicit substances. And so that's where we hoped the problem that we're hoping to solve is be better connected to our end users, the companies that are dealing with overdoses, people in recovery, understand what's in the illicit substances itself, and create a wider assay of things that would trigger a positive and not a positive.
Okay.
Because if you test for something like fentanyl, there's over 150 analogs of fentanyl out there. We actually developed a test for something called orthomethylfentanyl that showed in a Q4 report of last year of being more prevalent on the streets. Normal fentanyl tests in our competition would actually not pick it up and not treat it as a positive or a negative. We developed a test within 6 weeks to then trigger a correct result for that specific analog. So um,
Wow.
it's just hard to keep up, really.
And last time I think we spoke about, the screening pathway being a little bit
Mhm.
backwards. So you needed bad symptoms before anyone would screen you. And the whole point of screening you is to do it while you feel fine.
Yeah.
I'm correct in saying that, yes. So
Yeah. Yeah.
the $25 test that you've built can buy now without a referral. So what had to be true scientifically and commercially to make this possible, this product?
Yeah, so we're talking about colon cancer screening product, which is again falls into the umbrella of in vitro diagnostics or point of care testing. But in general, Topaz, we sought out with the mission to find areas where a simple diagnostic test would produce massive impact or rectify situation, and that we proved that to be true in drug testing. Another vertical that we started to explore was um, cancer screening, and through my own diagnosis of
Yeah.
colon cancer, um, we understood that there's a major gap where guidelines are not keeping up to the actual rates of colon cancer. And the best way to screen for these tests, you typically would need to follow the guidelines. And so it is a catch 22. And a problem with point of care testing or in vitro diagnostics is the clinical validation is there, the science is there, the innovation is there. Accessibility in our healthcare systems is not, and is a big problem.
Big time.
And especially within colon cancer screening, that's something that we hope to solve.
Okay, amazing. So we spoke last time about, the roadside THC test for law enforcement. It's
Mhm.
in effect a breathalyzer for cannabis. Where is that today, and what's the hardest problem left to solve on it?
Yeah. Well, mom's the word. I can't say too much right now
Yeah,
because we got
okay.
a few things
Exciting.
cooking there. But it's something that again we saw as a is an area that needed an objective tool to bring um, to take subjectivity out of something that's critical. And obviously, someone driving under the influence. We've all heard of drunk driving and the impact it can have, and we probably all know someone that's been impacted by a drunk driver. And it's caused a lot of deaths. Now, with the greater legalization of THC, the same thing applies, but there's lack of an objective tool, and that could really save someone's life.
Yeah, big time.
That could also bring a lot more peace to law enforcement's eyes on reduced liability because they have something, as opposed to just being able to say your alphabets backwards, which I can't do sober anyways. Um, you now have an objective tool on the belt
Is
to
that
give you an
actually
indication of how to process things.
is that one of the tests?
You know what? For a lot of counties and states, they have drug
Um,
recognition experts where they will do a lot of subjective testing to see if someone's under the influence or not. And you need those steps. I'm not saying any of those steps are bad, and people are really good, but objective objectivity is always going to lead you to a better place on both ends for the person driving and for public safety, also for liability for law enforcement.
So the Topaz, some of the stuff you're doing, it sounds absolutely fantastic and very much needed, and it's plugging a huge gap with almost just like a simple diagnostic test.
Yeah,
So
absolutely.
5 years out, which problem do you most want people to associate with the Topaz name? Then?
Yeah, Topaz is an organization that is bringing simplicity to areas that matter. We want to be known for a company that is not afraid to bring accessibility to the people that need it most. And so right now we're focused on these three areas, laser focused, and we proved in it in one vertical. We are in the midst of proving it in two more verticals within law enforcement and within pharmacy, but we want to be known as the company that's not afraid to bring accessibility to people that want it, that need education around it.
Yeah.
Yeah,
So you grew above plan in year one, as we mentioned at the start of the call.
yeah,
What has to be true operationally inside Topaz for year two to keep at that pace? And then also aligned with that, what breaks first if you don't fix it?
yeah. Really good question. I think for us to prove ourselves right is a couple things. Is we need to continue to hire and have a great team. Um, you can have great ideas, products, which we do, but nothing works without a phenomenal team. And why I care so much about culture, team members, people, development of people, is because nothing happens without great people behind them and great teamwork. And so that's priority number one.
Yeah.
And priority number two, I think you mentioned what will break first. Uh,
Yeah.
Repeat that for me, you can.
I said to keep at that pace,
Yeah.
what breaks first if you don't fix it?
Yeah. So I think, of course, with healthcare, there is a lot of regulatory loopholes. It is complex sales processes. It is different stakeholders. So I think it's the ability to pivot. It's understand and have willing partners who also feel aligned to the mission of like status quo is not good enough right now. Um, and people who innately care about the problems that we do and are as driven as we are, we want to partner with. And so getting to those people, organizations, strategic partners is equally as important to us to make sure that we get the word out in the right places.
It's about partnering with the right people aligned with your mission.
Yeah,
So,
totally.
last question. You said to me before that adversity is a gift. For the founder listening who is in their own worst month right now, what do you know now that you wish you'd known in yours?
Yeah. Um, that your worst month, whatever it is right now, is peanuts, and people would think it's cute, maybe, some of the other people that have dealt with their worst months. And it's not to minimize what you're going through. Adversity's tough. It sucks in the moment.
Yeah,
But it's consistent, disciplined efforts that where you can rise above it. For me, it was running a startup, launching products in a week of undergoing chemotherapy, surgeries, and losing my mom. Um, and that's tough. Life is tough, but it's not always the case. Tough times don't last, but tough people do. And I think any founder that's going through those moments is, do you have the right team to pick you up when you're going through that? Do you have people surrounding you that make you better? Or if you're the average of the 5 people on your team, are you good with that? Um, and uh, and yeah, I guess the tough times don't last. Tough people do is what I'd leave it at.
love that.
Yeah,
That's a very strong closing statement. And look, I love what you're building at Topaz. I love the mission you've been on. We didn't even get
appreciate you, Harry.
on the closest 5 people around you, because I know that's a brilliant point that you mentioned to me before. But we may have to have another podcast at some point to dive into things. But
Yeah,
Ed, I've loved having you on. I love the short, sharp answers and how we navigated that. And look, I will include a link for people to check out Topaz Diagnostics below, and a link to Zed's LinkedIn if you ever have any questions or want to communicate with him. But Zed, thank you so much for coming on, my friend.
appreciate you, Harry. Thanks for having me.
Cheers, buddy.
All right, take